with that, I would like to introduce Dr. Joaquin Arambula.
Hi, it's Joaquin. Just want to make sure that you can see me. There we are. Hello, everybody. So I just wanted to share a little bit with you. I'm kind of excited to be able to address everybody. Wanted to tell you a little bit about myself, and then would be happy to take any questions that you have. You know, I practiced medicine for the better part of 10 years in an emergency department, taking care of everyone who walked through my doors, and was proud that I worked in Selma, which is the raising capital of the world, taking care of a predominantly farm working community who had great needs. I work and live in the central San Joaquin Valley. It's where I'm from, and you know, we have problems with air quality and water quality, and saw many patients who came through my ER and struggled to feel like most days felt like Groundhog's Day. That as much as hard as I worked, that the next day I'd come back to work, that there'd still be a line out the door, that we weren't making significant improvements into population health, that I couldn't do it seeing one person at a time, and felt that I needed to become more of an advocate. So what I did is stood up. I decided to jump and run for office. Everyone kind of told me not to do it, you know, but at some point we get the government that we deserve. And unless you're willing to be a leader and to stand up and to fight as an advocate for your community, then you're stuck with the government that you have. So I went and did something about it and ran for office. And luckily enough for me, the people of Fresno County elected me to be their representative up here. I now work in Sacramento, our state's capital, and chair the budget subcommittee of Health and Human Services. It doesn't sound like much, but we have oversight over $100 billion that the state of California spends on healthcare and welfare. We make improvements to combat specific epidemics and problems that are occurring in real time. And we're trying to deal with how we get ahead of some of the cost curves that are facing us in healthcare. So I wanted to talk to you about some of the things that I've been advocating this year, and then would honestly love to take some questions. Things that we've been working on are how we start dealing with diabetes. As many of you are aware, we have significant problems, mostly within the Latino community that I come from. We have problems with obesity and diabetes, and we wanted to support something called the Diabetes Prevention Program. It's a program supported by the Center for Disease Control. It's evidence-based and has shown that by investing monies early on in diabetes, you're able to prevent people who may have prediabetes from entering into diabetes, but you also decrease the amount that their health care will cost throughout their lifetime. It's kind of a scary straight program if you have diabetes. Within the first 30 days, you meet somebody who's can't see, you meet somebody who's on dialysis in the hospital 3 times a week, or you meet someone who's got an amputation, and essentially they tell you from their own mouths that what they would have liked is information earlier on in their disease process to deal with this. So that's something that we as a state, our assembly has decided to invest in this year. It's the first time our state ever has. I believe that will help us to address a major epidemic facing our community. Second one I wanted to talk about is STDs. STDs are running rampant through the state of California, and it's not just young people, it's everybody. And we have to find a way to actually talk about the problems that we're facing and make sure that we have the resources to deal with them and combat them. The final one is opioids. We as a country have really faced a long problem with opioids. And we see now 46 people a day dying from opioid overdoses. Working in an ER where you're the one to take care of them, trying to revive them or to speak with their family afterwards, you know, I recognize how important it is for us to deal with this crisis head on. So we have gotten a federal grant for over $40 million for the state of California to help to invest in innovative programs that help with treatment for opioid addiction. We're also carrying a bill this year that will start to address and deal with these issues as well, because it's very important for us. So, you know, I just wanted to be able to tell you more about myself, and would love to be able to continue to talk, but I learned something as a physician, which is it's better to ask questions than to talk all the time. And so would like an opportunity for those who are watching this and participating to be able to ask me questions so that I can make sure that I'm addressing your concerns, and looking forward to this conversation. So.
Hello, everyone. So now is an opportunity for everyone to start asking questions. Feel free to unmute yourself. We do have one question in the chat box. How much time do you spend as a physician and as a politician?
Great question. Since I have a wife and 3 kids, and politics is full-time, I've actually taken a leave of absence from my practice. A year ago, I saw my last patient. I worked a graveyard shift in the ER. Those of you that don't know, we call ourselves pit docs. It was the last time I went into the pit. I don't think it will be my final time, but advocacy takes a significant amount for you to be able to move the needle. And I feel that by advocating and being a public servant right now, I'm best able to deal with population health. And so I just don't find any time to stay up to date on current medical literature or to be a good husband and father and a good public servant. So for the time being, I'm taking a short leave of absence from my practice, but hope to find time later on to come back to it.
Thank you very much. Another question is, as students, residents, fellows, or young faculty, how can we be most effective in supporting you and improving the health of California?
First, I'd say by listening to your patients. Second, I'd say to take their stories and use them as advocacy. You know, I'm moved thinking about all of the patients who I saw. Over my 10 years, I took care of 50,000 patients. Taking care of that number of people really allows me to tell their stories while I'm up here. Those stories are powerful and are something that the public servants usually don't hear and aren't aware of. And that's a valuable role that residents and fellows and doctors can play in helping to shape public policy.
Thank you. Another person asks, did you find it difficult to go into legislation being a physician, and specifically, did it make it easier being an emergency physician rather than any other specialty?
Funny that you asked, right? I mean, ER, we're used to a bit of crisis. We are quick on our feet and can handle anything that comes in. I also tend to think we have ganas, a bit of confidence to be able to handle things that are really coming down the pipeline. And, I did gain that from the ER. I felt well suited to enter into politics. I think, physicians are patient advocates, that we already fight for our patients and work hard on their behalf. We're now just fighting on a larger forum. I also think that this is where the tools are. And for us to be most effective as advocates, we have to go into a new pit and take on new challenges and look forward to continuing that.
Thank you. Another person asks, did you have any experience in politics prior?
I never ran for office before. I never ran in high school for anything. My dad was involved in politics, and as a young kid, I saw a father who was married to his constituency, who was always out at events, and who loved his community and cared for it. But he wasn't home as much as I would have loved as a kid. I think as I grew older, though, I appreciated the modeling and mentoring that he provided for us. That for good public servants, you have to be willing to sacrifice yourself, sacrifice your career, your time, monetary gain. You have to be willing to lead. And to do that, I needed to actually follow in his footsteps. And so while I never ran for public office before, it feels like I'm putting on my father's coat sometimes when I'm here. And it fits, so it works. I wouldn't let that be a deterrent, though, for those of you who are concerned or have never been involved in politics before. You end up just jumping. You jump with both feet, and you try, and you run as fast as you can, and you see if you can get elected. And great things happen. You know, doctors are well respected, and we have an opportunity to be experts in policy and to be able to discuss problems that are facing our community.
Great, thanks. Another person asks, a current pressing issue is the single payer bill SB 562. What is your take on the bill?
Well, I have a ton of questions. You know, first, I believe that healthcare is a human right. I took care of everybody who ever walked through my emergency department doors, and I took great pride in doing that. We never turned a person away. We took care of them because they were a human being who was asking for my help. You know, we've started to see some of the information on this proposal, and we'll have to take a hard look at it. You know, now that I'm the budget chair, I actually have the responsibility of making sure that we can pay for what we plan. And so I'm going to take a really hard look at the proposals as we put it forward. Dr. Wood and myself have started a select committee that will meet later this year as we start talking about universal health coverage. That's what we need to be trying to get to and working to, and we'll be asking those tough questions regarding how do we pay for this? What does it look like? How do we work towards that goal? And hoping to really build it up.
Thank you. What are ways to get involved in health policy and advocacy?
Well, I'd first say follow me on Facebook and Twitter if you want. I'd love to have you follow some of the things that we're doing. You know, things happen in real time. You can't do it from your couch. You're going to have to get involved and go to your health districts or school board races, or figure out if your chief medical officer or public health officer is looking for input and advocacy, and then find a specific issue that you can help to champion. While it's nice to be a generalist, it's kind of nice to walk in and say, today I'm specifically asking for Parkinson's. Today I'm specifically working on diabetes, and here's what our proposals are. Find an area of interest for you so that you can become an expert. That expertise will allow the legislators and people who will be making the decisions want and need to listen to you.
What do you read every day, and what are your favorite readings? What should we be reading to learn better ways to improve health of our patients?
So my staff gives me about 100 pages a night to read. It's a lot. You know, I read it most nights. You know, a fair amount of it's our agendas for the next day, or preparatory material for different bills. I actually geek out and like being a bit of a policy wonk, where I dig into the material and study it. It's part of being a physician that you want to do the primary research yourself, that you look at the material and make an analysis, and then you own it. You know, that's what happened in the emergency room for me, and that's how I take towards advocacy. You know, I do try to look at best practices, so I focus on websites that are looking at what different states are doing. How, you know, I don't want to necessarily reinvent the wheel. I want to implement what already is working around the rest of the country and see if I can help that here in the state of California. In terms of local things that I read, I tend to read something called ourtumble.com. It's a compilation of articles from across the state broken into subject matter, and really gives me a good opportunity to read what's happening in all of the newspapers across the state.
What are some of the pressing health issues that are most difficult to address or to find support for?
Well, I'd like to talk about mental health. You know, this is Mental Health Awareness Month, and it's really hard to deal with issues like substance abuse or homelessness without adequately talking about mental health. Working in the ER again, I saw too many times how much people's physical health was tied to their mental health, how their housing was tied to their mental health. And we still have a stigma in regards to mental health that does not allow us that opportunity to adequately treat it and address it. You know, I'm looking forward to working with previous champions like Mayor Darrell Steinberg to try to see if we can come up with what is a 10-year roadmap for us to start dealing with a critical issue and helping to destigmatize it. But that's one that comes right to the top of my mind. It's It's one that we see every time we walk out of our homes or into our communities. And we all know that there's a great need and something that we need to be working on tirelessly.
What degree, either master's in public health or master's in public policy, do you recommend to get in addition to into medicine and health policy?
So it's funny you ask. I did not get either, but I considered it. So I went straight from college into medical school and then practiced for the 9, almost 10 years. And I thought, well, maybe I'll take a break and go and get a master's degree in this and then enter into it. My wife convinced me actually just to run. And I'm glad she did, because we won. And maybe we wouldn't have won if we had waited or timing was different. But I think after you have become a physician, you have all the tools you need to be an advocate. That an MPH and an MPP are good for helping you to deal with and understand and analyze things critically, but they're not necessary. They're not required for you to be able to run for office. And I would just say, if you feel that the time is right and that you're ready to make the jump, then jump with both feet and run as fast as you can.
Do you or does your office have any opportunity for an internship?
We do, and my chief of staff, Hans Hamann, would love to be able to hear from you if you have an interest. So if you reach out to our capital office here in Sacramento, or in room 5155, we'd love to be able to talk with you and interview you.
How can we best respond to the crisis of so few Latinos going to medical school, and when they do apply, they are not getting in?
So that's a wonderful question, and one we're trying to work on hard right now. I introduced a piece of legislation this year, AB 207, to help to bring a medical school back to the Valley. Now, the idea for me was really stemmed from how few Latinos and were taking care of our community. In the state of California, as diverse as we are, 40% of the patients here speak a foreign language, and yet less than 5% of the physicians do. It's hard for me to feel like we're communicating with our patients if we don't speak in their native tongue. It helps to build trust and establish relationships, and believe that the best way for us to do that is to train people who are from the communities to stay within their communities. So I'm going to continue to work on how we can train more physicians to come back to the Central Valley, places like mine which have severe disadvantages. And I think the best way to do that is to train them as locally as we can.
What role do medical students and physicians have in health policy?
They're vital. I mean, I love when I get to go walk around the halls and I'm seeing people wearing their white coats, short or long, doesn't matter. It's time for us to actually use our offices to be able, as physicians, to be able to advocate for our communities. I always felt like I was on the front lines of healthcare, that here in Sacramento, they didn't understand the struggles that we were going through on a daily basis. And your voices are critical to help to tell the stories of our patients and their struggles to access care, their problems affording their prescriptions, the fact that the systems aren't seamless and that they're cumbersome and difficult. And so you're very important to be able to help carry that message here in Sacramento and to other public servants.
How often do you communicate with those in Washington, D.C.?
Oh, DC's been a bit dysfunctional recently, and honestly, I kind of wish they'd stay that way. But we have our plate pretty busy here in Sacramento, keeping the state of California working and working well. I believe that we here in California are the beacon for the rest of the country. We've implemented the Affordable Care Act well, have expanded coverage, and have done a good job of being a shining example of how healthcare can work and how health access can continue to be strengthened. I do think that there are areas that we can improve and should improve. Predominantly, I think we need to start looking more at metrics and data, and not as much on rhetoric. How are we actually following and making sure that the best policies are being affected and are getting the adequate resources? I believe you have to look at data and metrics to do that.
What is your vision for healthcare in the future?
I said it at the start, I think healthcare is a human right. I think we have to find a way to make sure that we're taking care of our community. I think it's infrastructure into our people. And rather than spending it on other things, our priorities need to be that our people and that our community are kept healthy. You know, I know where I come from, that's not always the case. And I saw too often times where I had to sign someone's death certificate before it was their time, and feel that we can do more and should do more to help our community to thrive.
In your experience, what are the most prevalent social determinants of health in the Central Valley, and how can constituents help and address these?
Air quality and water quality. Those are the ones that I look at a lot. So it's hard when the number one reason why kids miss school in Fresno is asthma. It's hard when you see clusters of outbreaks of cancer and wonder whether or not it's related to water quality. In our community, we have problems, you know, and we need to be able to talk about them and be real about them and say that even if I get you better in my emergency department, it doesn't mean you don't go back home and get sick because of where you live. And we need to address those problems so that health becomes center again.
Thank you for pushing for another medical school in California. Communication is key to providing high quality and safe care. How can we increase more clinicians to speak Spanish?
Pues, ¿qué necesito hacer? Es empezó que practicar todos los días que tienes pacientes. Yo empezó en el hospital, la sala de emergencia, donde practicar con toda mi gente. Hay 60% de las personas que entran de mi sala de emergencia que puro habla en español. Y necesito que practicar cada día para ayudar y apoyo a mi comunidad. Sorry, I was speaking a little Spanish. I just was saying how, you know, I practiced and worked hard with my community because that's what they needed. And I wasn't as fluent when I started as I am now, and I can always get better. But I worked hard because over 60% of my patients preferred to speak in Spanish. And I felt that as their physician and someone who they trusted, that it was incumbent on me to work harder for them and on their behalf.
How much time do you spend between your office in Sacramento and the community you are representing in Fresno?
It's about half and half. So for 7 months out of the year, we're here 4 days a week. So half the year, we're here half the time. The remainder of the time, I go back home. I grew up in the 93728 zip code. It's the same zip code I live right now, and I'm raising my girls. That's home for me, and it's the Tower District in Fresno. It's nice to get back to my community and to my roots and to my people, and to find people who I connect with and am honored to represent. It's really fun and humbling to be a public servant and to feel that people trust you to be their voice and to fight on their behalf.
Who are your go-to people, organizations when you need support, and especially when you feel like everyone is against you?
Well, my support is usually my family. You know, I lean on my wife and my 3 daughters. I find it quite grounding when everyone is pulling on you here to go home and have to change diapers and do chores, because it reminds me that sometimes, you know, my dad had a funny way of saying it. He said, if you're taking arrows from all sides, you're probably in the right place. You know, oftentimes good public policy is policy that takes a lot of working on and never is perfect, but is always incremental and moving the conversation forward. Like, part of my ER personality is to say, you know, that we keep moving and keep doing as much as we can, and we work as hard as we can. you're never perfect, you never expect to be, but you're humbled by the fact that you have a great opportunity to make change.
How soon do you think we might implement a single payer health system here in California?
Well, we're going to have to really work on the fiscal parts of this first. So that's the part where I think we have gotten some new information this week. I haven't had time to digest it, but it's the first fiscal analysis we've seen of it. And we're going to have to take a real hard look at what that means. Now, the first numbers I saw were pretty high and astronomical, and something that we're going to have to really start digging into what their assumptions and expectations were. I know within the committee that we're forming, we plan on asking some of those questions and start working on some of the answers I know people in the community need. But I think we should also make sure that we're making an apples to apples comparison, because there are multiple different versions and different types of hybrids that might need to be looked at as well as we go forward, and would want to add that to the conversation.
How do you personally take care of yourself, and what is your work-life balance like?
So I'm a bit of a workaholic. Most of us who get through medical school are. It's probably our type A personalities. You know, I like to exercise. I try to play sports. We have an assembly softball team and a soccer team, and I was a starting catcher last year, and I'm trying to be a forward, or I don't know. I'll see if I make the soccer team. But I actually like it, and it's fun. I went for a run this morning just to kind of clear the air, and I tend to run around the Capitol. It's still amazing to think that I wake up and I go to work here. You know, I'm proud of the fact that my grandparents came to this country and didn't have papers, and here I am going to work in our state's capital and fighting for a community that often feels like they don't have a voice, and I get to be that voice here. And I recognize I have to try and take care of myself as best I can, but really my responsibility when I'm up here is to fight on my community's behalf.
What advice do you have for immigrants who lack documentation but aspire to be health professionals? And this includes undocumented immigrants currently attending or applying to medical school.
Yo creo que todos somos iguales y que aquí estamos y no nos vamos, que son tiempo para que todos tenemos los mismos derechos. I think it's time for us to fight for our community and say that we have rights too, and that we need to stand up and be proud of where we come from. Some of us are newer than others, and that's okay. We accept all of our communities. I fight for all Californians, everyone who comes from where I come from.
Do you plan to run for other offices aside from assembly member?
No, I kind of like this one. You know, I'm going to be here for a while. Yeah, I'm going to try and do this for a decade. My plan is, if I can sit down and really take a look at our state's budget, can I help to fix our values and our priorities? Can I start to reinvest money? As much as it's nice to change policy and to work on the words on a piece of paper, I prefer to actually work on how we pay for things. I think that sets the values for our state. You know, we're looking at, for the state of California, expanding access to things that currently have been optional for the last several years. Things like adult dental benefits for Medi-Cal, things like vision for Medi-Cal patients. You know, I'm looking at how I can possibly expand that, and if I can find a way to help to pay for it, and at some point, that's a dramatic improvement for my community. And I would be honored to continue to serve on their behalf up here in Sacramento.
What were some of the obstacles you overcame in higher education or medical school, and what were keys to overcoming them all?
Well, I was much younger back then, and you know, I liked to have fun sometimes. I think we all have to learn that it's a great responsibility to become a physician, and that we owe it to ourselves and to our patients to be the best person you can at work. and to really fight on their behalf. And that sense of responsibility comes from maturation, comes from practicing medicine and spending time with your patients, realizing that they trust you and come to you for your opinions.
Who have been your greatest mentors and how have they helped you to overcome or to become who you are?
So I'm a big fan of Kennedy. I really liked how he was a leader who had a vision. He kept saying we don't need to deal with the crisis of today, we need to be planning for tomorrow. I take that mentality with me. So, yes, let's deal with the problems we have, but where do we want to get a decade from now, and how do we get to that place? I also was born in Delano and really was touched and moved by Cesar Chavez as a young boy, and feel that he has been an advocate who fought for health and inequities and really worked hard. So I'm trying to look up to many people, but find that those two really stick out to me. And if I can, I'll just throw in a plug for my dad. It's kind of nice to know that he worked all those years so that he could teach us important lessons.
Have you considered working with the UC Davis School of Medicine, San Joaquin Valley Prime program to help them expand and become successful, as it is a program that aims to bring students from the Valley back to the Valley to practice?
I have, and will continue to have those conversations. One of the struggles we have is currently the San Joaquin Valley Prime program, I think, is at 12 students a year. That's not quite as many as we need, right? I'd say we need 100 students in the Central Valley. Currently, we have half the number of doctors per capita as LA and San Francisco, and it's a struggle to access care from my communities. So I think we can take a strong look at how we expand the San Joaquin Valley Prime program, and I think that's something that we want to do. We struggle with a bit of this idea, though, that the UCs are constitutionally autonomous, that they are protected from anything we do here in the legislature. I have no guarantees that if I gave them $100 million to be able to expand their San Joaquin Valley Prime program, that they'd spend it on the San Joaquin Valley Prime program. They might prioritize something else that they want to build instead. And so as we have those conversations, I'd like to just be ensured that whatever funds we spend would be dedicated and tied to the San Joaquin Valley Prime program. I do want to say, though, I think it's a very good program and has trained a family friend of ours. I'm needing to see better results of them getting placed into residencies within the Central Valley, though, and feel that that would be a good way to do it.
Does anyone else have any questions or would like to personally speak with Dr. Arambula?
Hello, can you hear me?
Yes.
Hi, Dr. Arambula. My name is Desi Manso. I'm currently a second-year medical student at UC Davis in the San Joaquin Valley Prime program, and I'm just really eager to work with you this summer. I don't know if they've contacted you about me possibly interning with you, and I'm still waiting to hear back. And I don't know how busy you are that they haven't informed you of this, but just waiting.
Well, Daisy, I can tell my chief and try and see if we can promote it. They had not informed me. I try and tell people about the schedule that's outside of their awareness. Yesterday, we closed out our budget subcommittee. So we put in how we, the state of California, are going to fund $124 billion. We did that yesterday. We have to close out the budget by June 15th, so in the next 3 weeks. It's kind of our busy time, but I would expect after June 15th, we'll free up quite a bit of time and have some ability, but would love to find time to bring you in. The other thing is just come into our office. I'm always supportive of people who grab the bull by the horns and, do it themselves. So coming into our office here at the Capitol at 5155, you'll get your voice heard. Chances are you'll see me or one of my staff. We're here all the time. So
Great, thank you. I'll probably just end up doing that then.
Thank you, Daisy.
Thank you.
This is Ivan. So I am a DACA beneficiary, and I do access healthcare because of my DACA status. Um, in my advocacy work, I constantly have to debate with people who say, why do we need to provide access to healthcare for people like you who don't belong here? Um, what is your response to people who do pose that argument that I shouldn't receive access? The least I can do is not take up any benefits.
So, great question. Let me just start by saying I have several people on my staff who are DACA as well. I actually think they're members of our community and are Californians. I'm proud that our state has passed Health for All Kids, which is SB 75 a few years ago. You might not know this, but in the budget we passed yesterday, we did Health for All Young Adults. So anyone up to the age of 26 will be able to now access. Personally, I think our communities are stronger and better when we are taking care of everyone who is within our communities. I think about things like epidemics from measles. It's important that we have preventative measures for everyone within our community, that we have worked hard for them. They have worked hard and are paying their fair share of taxes too. So I fight back a little bit on that notion and really would like to say that, dreamers are like so many of us who still have dreams to make this place better and to make it a more perfect union.
Thank you. Another question. In this political climate of uncertainty and fear, how can we ensure the general public is reassured when healthcare is still a priority in California? And how can we also empower patients and the public to not be afraid to speak up and support health policy?
Well, I think the first thing you can do is vote, right? I mean, at some point we get the government we deserve. Not enough people came out last time, and not just here in California, but across the United States. And if we're not adequately turning out and getting candidates and people who are speaking about healthcare policy or speaking to our issues that affect our communities, it's a struggle to get them to change after they're in office. So I would just remind people to try to make sure that you're using the power of the ballot box.
Are there any other questions or any other individuals that would like to address Dr. Arambola specifically?
Dr. Arambula, this is Efrain Montes at UC Davis. I'm a faculty in internal medicine. I just really wanted to thank you for taking the time. Your story and your passion is very inspiring. And I just wanted to echo what some of the folks asking, whatever we could do to support you, to make sure that California stays focused on the needs of the Central Valley and our patients there. Please count us in.
Well, thank you. And, thank you, Dr. Montes. Maybe what would be fun is to have you guys come to one of our hearings next year. Maybe you guys would like to focus on a specific advocacy outreach issue that you feel speaks to you. So would love to be able to talk to you guys through the fall. Usually it's our quieter time, to be able to see if there's something that you want to focus on next year. So I would love to be able to make that happen and go forward from there. But also would like to at some point come out to UC Davis and speak to your students. If you guys would ever have me, I'd love to do some outreach and come out. I'm local here. I stay here 4 days a week, so I would love to find some time if that works out for you.
Thank you.
And people on the chat box are thanking you for your service. It's been very insightful. Thank you for your time and advice. Any other last minute questions?
Well, if I can say one last thing, I'd hopefully, maybe I'll just close with it. It's strange for me to think that our state's been around for 160 years. We've elected almost 3,900 assembly people in that 160 years. I'm the first Latino medical doctor our state's ever elected to statewide office. It's amazing to me to think that we've come this far, and we've never had one before. And I think we need to continue to break those glass ceilings and continue to be advocates for our community. And we do that because we're leaders within our profession. You know, I'm also the first Joaquin we've ever elected, so I kind of own that one too, right? But we get to be proud of our community and where we come from. And I'm honored that you guys would have me address you today. So thank you all for your time.
Thank you very much for your time, Dr. Arambula. And with that, I would just like to remind everyone to please connect with us on mimentor.org if you haven't already done so. And also to download the app via on Google Play or Apple. And also any upcoming events. Tomorrow we have RCC to MD Path of a community college alum in Riverside, California. And also to plug in, if anyone is interested in joining the Me Mentor board, the applications are currently open and the deadline is May 26th. On Monday, we have a Together We Mentor webinar for medical school in the Caribbean for those interested in going to medical school in the Caribbean. On June 2nd, we have Together We Mentor with UC Davis SGV Prime in Fresno. And also June 3rd, if you're available to attend the Me Mentor Gala in Los Angeles. Thank you again, everyone, for attending this event. And this will conclude the webinar series. And again, thank you for LCHC for helping organize this, and also Me Mentor to hosting this event. And have a good night, everyone. And this session will be recorded, and we will send you a link to the recording sometime tonight. And please also remember to sign or to fill out the Survey Monkey that will be sent out so that we could provide you these services in the future. All right. Good night, everyone, and thank you.